Hi, we're back. We're now taking the impression. I've already removed the cord and now I'm placing, injecting the first amount of the VPS and then of course the second. Getting ready to seat the tray, and this is a triple tray, and she's going to go ahead and just close straight down all the way, and we're just going to let it set for about 6 minutes. And while I'm letting it set, I'll try to discuss some more of what I do with getting ready to make the temporary. Um, I am filming through a microscope, so it's a automated color for the microscope. I now have the impression, alginate impression in my hand. I'm going to go ahead and show you what I do. I like to trim away a lot of the things that I feel like are going to get in the way. So in the occlusal embrasure, I'll trim that. I'll come down, take out the buccal papilla. I'm using a Hollenbeck. I believe it's a number, I think it's a half Hollenbeck. It has just a nice type of cutting edge to it. So I'm just removing the interdental papilla away from the alginate impression so that nothing will get in the way and it'll see properly. I've had sometimes problems where if I didn't trim away the interproximal areas that it would fold down onto the bite and change the bite, and I'd have to adjust. So I get in the habit of just doing that. We will be pouring this impression with snapstone. I have 3 bowls that I'm going to have ready with snapstone in it, about a quarter scoop of snapstone, and I'll pour into the impression. This is after the patient's dismissed. I'll pour right into the impression, and I use a system called WOW. It's a WOW system. I don't have it here to show you, but I will next time when we go to seat the crown. I'll show you what that looks like. I give that bite alginate a pour up on both sides, mounted within this self-contained articulator. That goes to the lab, and then they have that. Now this is the integrity. This is the actual material I'm going to use to inject into the alginate, and then I'll inject a little bit in the mouth. So while we're waiting for the impression, it's good to have everything ready. She's going to have a bleach shade to match up to her adjacent crown. Now we use I believe BL4 from Ivoclar for the Emax on number 3. We'll let that light adjust a little bit right now. We're getting a little reflection. Here we go. So B1 was a little too yellow, so we decided to go with BL4. And I believe she's an ND5 for a stump shade. So you can see the contrast between the two. The BL4 just brings a little lighter look to the tooth, and she's very happy with that. In fact, the lab gave us back the crown with some stain on it. I did ask them not to stain it, but evidently they got stained, and so I just hand polished the crown, and it came out beautifully, and the color matched perfectly. So Emax does polish very well. Alright, so we're getting closer to our time. It's been about 4 minutes. Some other things to just be ready is the ND3, ND4, excuse me, it must have been an ND4 on the stump shade. So I take a photograph of both the stump shade and the regular shade guide, send that to the lab, and this way they got everything they need along with the impression. So Ivoclar, again, you wish they would have a little better stump guide. It seems like these colors are very chromatic, and they could probably afford to add to the number of shades to select from. So here we are, coming up around 5 minutes, and again, the alginate will be dual poured after we're complete with our treatment. So I'll cement the temporary and then instruct either myself will go back and pour it, or my lab assistant will pour it. And snapstone sets very, very quickly. And about 30 seconds to go here. I like the Reprosil impression material. I think it works really well for what we need in our, crown and bridge, routine crown and bridge. I've been using it for years. I'm sure there are other products that are out there that many dentists are using right now, and also in dental schools. But if it's not broken, don't fix it. So I still enjoy using it. Again, just being careful, attention to detail. Looks like we're coming up on our time. So after we pull the impression, then we'll get right to the temporary. And the stability of that material, it's very durable. You can take your alginate and set it and pour it at the end of the day. It's very, very durable material. Zermac, I believe, is the name of the company, and it's a purple material. I'll try to get you the name at another time. Okay, so we're going to have her open. I'm taking the impression out now very gently. Notice I had her open the lower, the opposing first, and then I teased out the upper. I just don't want to tear my impression in any way. So there's the impression. As you can see at higher magnification, we got a very detailed margin all the way around the tooth. And we also look for voids in other areas in the impression, and it seems like we're pretty good. So, and our patient is happy that we got this impression first time around. I guess they say, scanning is quick, but you know what, I still like to have impressions. Something I can look at three-dimensionally. I can pour